In this video, we'll be going over perineum stretching, specifically designed for pregnant women during their third trimester of pregnancy. It is recommended that at around 34 weeks, you start perineum stretching because it is helpful to make the perineum a little bit more elastic and mobile in preparation for vaginal delivery. There is also some research that shows it can decrease your risk of tearing during delivery as well. And so just so that we understand what the perineum is connective tissue right between your vaginal opening and your rectum. So it's usually right kind of at the base of your vaginal opening. And the reason this structure is important is because there are many pelvic floor muscles and other structures that connect to this area. And so we generally want it to be pretty mobile and elastic so that we're not creating too much tension in the pelvic floor muscles or creating strain somewhere else. And it is especially important for things like when you do give birth vaginally, it has to be really stretchy and elastic to allow baby to be able to get pushed out, but also in general for things like sexual intimacy or even pooping, we want good elasticity in this area. And so if you are gonna try perineum stretching at home, I do recommend that you get into a comfortable environment. Some individuals like to do this in a warm bath, or you can try it, right before bed when you're sort of able to take a moment and relax a little bit prior to starting. And so what you'll do is you'll wash your hands, and I always recommend using lube, either a water-based lube, or you can try even coconut oil, just anything that's gonna help facilitate the stretching. So once you're in a comfortable position, you'll take 2 fingers or your thumb, whichever one feels more comfortable, and you'll insert it about a knuckle deep, like your first knuckle here, into your vaginal opening. And so you won't have to go fully in, you don't have to fully insert, you'll just be kind of at that opening still. And what you'll start off by doing is pulling straight down towards your rectum. You may feel a stinging or a little bit of a sharp sensation when you do that, and that is usually expected. What you don't want to do is stretch into too much pain, right? So we're not trying to make it a super painful experience, but it may feel uncomfortable for most people. When you have that position, you'll hold up to 60 seconds, and it's important to practice relaxation and letting go of any tension you may experience in that area. So sometimes I tell people to try diaphragmatic breathing or practice breathing into your pelvic bowl as you're holding the stretch and letting go of any tension you may be experiencing in that area to help the muscles and all of the surrounding tissues even further relax. Once you're done with that area, you'll take it over to the side and repeat the same process, and then the other side and repeat the same thing. So you're inserted at this point just to the knuckle, and you're stretching down and to the sides. When you're done with that, you may wanna perform some swooping motions, just trying to target any other tender spots or areas that may need further stretching, so that you're sort of getting the whole area of the perineum there. And so when you're finished with that, you can just, wash your hands, and you should be, good to go. Perineum stretching usually takes 5 to 10 minutes max, and I do recommend people do this, 3 to 4 times a week once you get to that 34-week mark and onward. If you're having any pain with it or just aren't sure, you have further questions, feel free to DM me on my Instagram at bellabenjamin_DPT or message me on my website. I hope this was educational and helpful for your perineum stretching journey.